Good morning, everyone. Good afternoon, everyone. Welcome to Unacademy, where you can crack all NEET PG exams with us, with our top educators, quality content, and have a great learning experience. A little about me: I'm Dr. Sasha Menon Remedius. I've done my MD in Anesthesia from Father Muller Medical College, Mangalore. I have 2 publications and 1 paper presentation in the field of anesthesia, and I've been working and teaching in Bangalore for the past 2.5 years. Today's topic is an MCQ on benzodiazepines. I have covered this class in 2 parts, and we will be dealing with the MCQ on benzodiazepines, a couple of quiz questions today. So guys, a little about Unacademy. It's one of India's largest online learning platform where you can get plus subscription and access to live and recorded courses from India's best educators, all at Unacademy. Now So what will you get out of Unacademy? Basically, we have our daily live classes, so where you can chat with your educator, engage in discussions, clear your doubts. So when you go to a coaching institute, it's a little difficult, right? First of all, it's a lot of time and energy that you'll have to put in to go to this to the coaching institute. Then again, once you'll reach them, you'll have to see to your place, and it's very difficult for your educator to clear everyone's doubts, because from the educator, he or she has a stipulated amount of time in which they have to finish the classes, and if it's a little difficult even for the educator to clear everyone's doubts. But here at Unacademy, you can chat with your educator, engage in discussions, clear your doubts and answer polls, and all this is while the class is going on. Then these are structured courses. So all our courses are structured and in line with your exam syllabus to help you best prepare for it. These are all structured and in line for your exams. Live tests and quizzes. So we evaluate your preparation with our regular mock test quizzes, and so I mean you can evaluate your preparation, and this helps you get a better idea on how you all are faring. So the educators have prepared, and whatever is best for your from the course point of view, that that is what is taught to you all, and then based on what is taught to you all, various quizzes and tests are prepared so that you all can evaluate your preparation. Then unlimited access. So one subscription gives you access to all our live and recorded courses, and you can watch from wherever you are, from the comfort of any of your devices. Now it is very important that you all go revise, you all go through material along with these classes, right? It is very important. We give you all a understanding of how to go about the topic, and it's very important for you all to go read, revise, and give these tests. These are some of our top educators: Dr. Nikita Nanwani, Dr. Mohammad Azam, Dr. Preeti Sharma, Dr. Devesh Mishra. Dr. Nikita Nanwani is a NEET PG mentor for radiology, as well as mnemonics and concept focusing on all encompassing, which includes all subjects. So mnemonics is very interesting part. For those of you who it helps, it's nice to prepare your own mnemonics too, as it helps you all remember better. Dr. Mohammad Azam, Dr. Preeti Sharma, Dr. Devesh Mishra, these are some of our top educators. These are some of the courses offered. As you can see, anesthesia, surgery, various subjects are there. You all have to cover all these subjects. I know NEET PG is not easy. It's quite hectic, but then we have to do it, right? And we're here to help you all with cover this. There are various courses under each subject too, as you can see. So basically, it's like I said, it's not easy, but we are here to help you all cover whatever is possible. And as you can see, topics like anesthesia, dermatology, radiology, psychiatry, these were not covered during your MBBS in detail, right? These were like small topics, like it's not small topics, but they were definitely not covered in detail during your MBBS, and you all just had to know about the basics. So these topics are allotted 11 marks, but unfortunately these 11 marks, unless you read, these are such topics that unless you read, go through them, revise them, you're not going to be able to remember anything to give to answer in those 11 marks, right? It's not going to be easy because you all haven't really gone into that much detail, and of course we don't concentrate that much too during MBBS on these subjects, as these are not our primary subjects. But these 11 marks are very easy to score, like how in MBBS you all just had to like brush through it. Even here they do not go, the questions will not be in depth about the topic. It will, but I'm not saying that will be super easy, superficial questions, no, but it will be what is generally taught to you all, and what, you know, what the basic trend is, that's what the questions will be usually. But with your physiology, anatomy, pharmacology, pathology, of course you all have spent a year in each of these subjects, you know, during MBBS. So these subjects are awarded like 44 marks and all, and they can go into depth in these subjects. So these subjects, of course, you all need to know thorough, and it's a little more tough scoring in these subjects. These are some of our ongoing courses in our platform: course on neurophysiology, GI surgery, cardiovascular thoracic surgery, larynx, respiratory system, pathology. Then coming to the subscription part of it, as you can see, there are 5 types of subscriptions. And for those of you who are giving NEET PG this year, so for those of you who are giving NEET PG this year, the 6-month subscription should suffice. But for the rest of you who are otherwise this thing, the 12 and the 24-month subscription, I would highly recommend. So these subscriptions give you time, they give you time to decide. So it was very helpful to me that 1 year, because it helped me decide what I actually like. I thought I liked something else, but when studying, you get to know what you want, what you don't want. You're going to be doing this for the rest of your life, so you need to enjoy what you're doing. So give yourselves time is what I feel. Nothing wrong in dropping a year. Nobody is going to ask you all how long you all spent to clear your NEET. Nobody, it's of nobody's concern, nobody's interest. They are not, nobody dwells into those facts. At the end of the day, it is all about practice and how you are faring in it. So like I said, economical wise also, I would suggest these courses, because these they are, it's a one-time subscription. So after 6 months, if you want to access the classes again, if you want to do the tests again, you won't be able to do it, right? So it's stipulated amount of time, 6 months, you all will have to pay again. Whereas your 12 and 24, you all have the buffer time. So if you use my code SASHA, you will avail a 10% discount. So please do use my code, guys. The discount applies to all these, okay? So as you can see, again, my code for your 10% discount. Now we'll come to the MCQs. I'll just set the watch. Just a sec. Okay, your first question is, as dose of benzodiazepines is increased, all the following occur except. I'll give you all 1 minute and you all have to give me the answer. I mean, you all can give yourselves the answer rather. I will discuss the question. The answer is cardiovascular depression. So as dose of benzodiazepine is increased, then benzodiazepines is increased, anxiolysis, sedation, hypnosis occur, but there is no cardiovascular depression. It leads to unconsciousness and respiratory depression. These drugs are highly cardiostable. Very rarely a small decrease in BP will be seen, no decrease in cardiac output and all. These drugs are highly cardiostable. All the following are long acting except okay. So your answer is midazolam. Yeah. So the short acting are triazolam, dimazepam, and your midazolam. So these are your short acting drugs. All the following are true except the drugs are not bound to plasma proteins. Diazepam is 96% bound, mainly albumin. They have a large apparent volume of distribution because all the drugs are highly lipid soluble. Long-acting drugs such as the following and chlordiazepoxide have plasma half-life of the parent drug plus the metabolite. So your answer is the drugs are not bound to plasma proteins. These drugs are highly bound to plasma proteins. Highly bound to plasma protein. Diazepam is the most bound, 96% bound, mainly to albumin. But even though they are so highly bound to plasma protein, there are not much drug interactions because of dissociation from the plasma protein. So they have a large apparent volume of distribution because all the drugs are highly lipid soluble. So these drugs are highly lipid soluble, so they have a large apparent volume of distribution. The long-acting drugs such as nitrazepam, midazepam, flurazepam, diazepam, and chlordiazepoxide, they have plasma half-lives of the parent drug. Yeah, so their they have the half-lives of the parent drug as well as a metabolite. Hence, the duration of action is very long. So, two compounds in clinical practice are water soluble. They are. Your answer is chlordiazepoxide and midazolam. They are compounds which are clinically water soluble. So the characteristics of midazolam are all are false except long acting, water solubility is pH dependent, causes seizures, and metabolism is independent of the liver. So water solubility is pH dependent. So midazolam is actually short acting. It is an anticonvulsant. Metabolized by the liver and excreted by the kidney. Okay, now these are the facts about midazolam. Now, the water solubility at a pH of 6, this drug is water soluble. Sorry, at a pH of 6, water soluble, and at physiological pH, so at physiological pH, this drug is lipid soluble. And can cross the blood-brain barrier. All the following are true except they are almost entirely eliminated from the body by hepatic metabolism, which usually involves oxidative reactions by microsomal enzymes in the hepatic endoplasmic reticulum. Midazolam, ketozolam, prazepam, chlorrazepam, diazepam all converted to active metabolite less diazepam. The highly lipophilic benzodiazepines cannot cross placenta. Although most of the benzodiazepines are extensively bound to plasma proteins, it is a free drug which diffuses across the membranes. So your answer is highly, they do not cross the placenta. These drugs do cross the placenta because they are lipophilic. Right, so these drugs do go across the placenta, and although most of the benzodiazepines are extensively bound to plasma proteins, yes, it is a free drug which diffuses across membrane. So even though they have high plasma protein binding, these drugs still diffuse across membranes, and they do cross the placenta. The placental barrier is reached. Hence, these drugs are not given in pregnancy. So as a pre-medication, right? So before any, if the patient requires general anesthesia for elective cesarean or emergency cesarean or any other, like if the patient has to undergo lap pull in the second trimester or whatever it is, these drugs are not given these benzodiazepines as a pre-medication. Now, why are these not given these benzodiazepines as a pre-medication? Is because these benzodiazepines cross the placenta, right? So they cross the placenta, and in the fetus the concentration is more than in the mother. This leads to respiratory depression, right? So they are almost entirely eliminated from the body by hepatic metabolism, which involves reactions by the microsomal enzymes. This medazopam, ketazolam, trazepam, chlorazepam, diazepam are all converted to this active metabolite desmethyldiazepam. As a result, the duration of action of these drugs is long, and like I said, they are highly lipophilic and can cross the placenta and cause respiratory depression in the fetus, hence not given during pregnancy. And although most of the benzodiazepines are highly bound to plasma proteins, it is a free drug which can diffuse across membranes. All the following are true about benzodiazepine receptors except so your answer is five broad classes. Actually, it is three classes of benzodiazepine receptors. Uh, 1 and 2 are found in the CNS primarily. So, two subtypes were originally suggested in the CNS. They are distributed unevenly within the CNS, highest concentration in the cerebral cortex and limbic system. And the third class is also found in the CNS plus peripheral. Your peripheral includes receptors in the kidney, heart, and some elements in the blood. All are true about GABA except benzodiazepines. lack intrinsic activity but have been shown to exert the effect by potentiation of GABA actions in numerous regions within the CNS. Two types of GABA receptors exist within the CNS. They are denoted by A and B. GABA produces anxiolytic effect by interaction with the 5-hydroxytryptamine in the limbic system. GABA has no anticonvulsant activity. So all the drugs that act on GABA receptor have anticonvulsant activity. So all drugs acting on GABA receptors bring about anticonvulsant So benzodiazepine lack intrinsic activity but have been shown to exert their effects by potentiation of GABA actions in numerous regions within the CNS. So even though they lack intrinsic activity, they exert their effects by potentiation of GABA effects. So they potentiate the effect of GABA. Okay, so they potentiate the effect of GABA in numerous regions within the CNS. Two types of GABA receptors exist. They are denoted as A and B, and GABA produces anxiolytic effect by interaction with 5-hydroxytryptamine in the limbic system. So it produces an anxiolytic effect by interaction with 5-hydroxytryptamine in the limbic system. As compared to barbiturates, benzodiazepines cause least distortion of sleep architecture and rebound phenomena. Discontinuation of regular use are less marked, and rebound phenomena on discontinuation of regular use. They have high abuse liability. Tolerance is more, psychological and physical dependence and withdrawal is more. A specific benzodiazepine antagonist flumazenil is more, and of course they have a high therapeutic index, benzodiazepines. So this is not true. They benzodiazepines do not have a higher abuse liability. Tolerance is less. Psychological, physical are less marked. So they have a high therapeutic index because of this, because abuse liability is very low, less psychological and physical dependence, and withdrawal syndrome is also less. So they cause least distortion of sleep architecture and rebound phenomena on discontinuation of regular use. So there's least distortion of sleep architecture and least amount of rebound phenomena. Now, a specific benzodiazepine antagonist, flumazenil, is known, which can be used in case of poisoning. So, barbiturates do not have this benzodiazepine, this antidote if there is any poisoning occurring. It is just a symptomatic treatment. And barbiturates cause a lot of distortion of sleep architecture as compared to benzodiazepines. So, the patient will wake up with a hangover, basically not fresh, seen with barbiturates. Okay, and rebound phenomena. So on when barbiturates are used regularly, if when discontinued, the rebound phenomena is very high. All the following are uses except. Okay, the answer is antipsychotics. So they are used for anti-anxiety, amnesia, and induction agents. They are not used as antipsychotics. All the following are side effects except blurring of vision, dry mouth, urinary incontinence, constipation, increase in nightmares, and motor incoordination. The answer is constipation. So benzodiazepines cause blurring of vision, dry mouth, urinary incontinence, nightmares, motor incoordination. These are rare nightmares, motor incoordination, all these side effects, but they do not cause constipation. As a hypnotic, benzodiazepine produces all except used to. So this is not true. It is used to shorten sleep latencycy latency so it is used to reduce nocturnal awakening. So basically used in insomnia patients who suffer from insomnia. Impaired performance the next day is largely related to dose of the drug. So these drugs, actually the longer acting drugs, they affect REM stage of sleep, right? So they affect the REM stage of sleep. So the longer acting drugs can lead to impaired performance, basically a hangover effect the next day, because the patient does get up feeling a little groggy because the REM, the main stage of sleep, is affected by the long acting drugs. But the shorter acting drugs, they induce sleep. Yes, they also affect the REM stage, but because of the short duration of action, they basically stop in the sense they stop affecting the REM stage of sleep, right? So they do not affect the REM stage of sleep after a period of time. The patient does not wake up, so patient continues to sleep well and gets up fresh. So regarding interactions with benzodiazepines, all are true except benzodiazepines synergize with alcohol and other CNS depressants, leading to excessive impairment. Drug interaction due to displacement from protein binding or microsomal enzyme inductions are not significant. Cimetidine OCPs have shown to retard benzodiazepine metabolism. Metabolites are not active and do not prolong the duration of action. This is easy, you all should get it by now. Sorry. The answer is metabolites are highly active and the T half of the metabolite as well as T half of the parent drug together prolong the duration of action. So, cimetidine, isoniazid, or oral contraceptives retard benzodiazepine metabolism because these are enzyme inhibitors. Drug interactions due to displacement from protein binding or or microsomal enzyme induction, they are not very significant. And benzodiazepines, yes, they can synergize with other CNS depressants, leading to excessive impairment. Additional uses are all except as centrally acting muscle relaxant for pre-anesthetic medication and IV anesthesia, alcohol dependence in dependent subjects, and along with analgesics, NSAIDs, spasmolytics, anti-ulcers, and many other drugs. So all are additional uses except. So additional uses are, they are not used as a centrally acting muscle relaxant. They are not used as centrally acting muscle relaxant. They are used for pre-anesthetic medication and alcohol dependence in alcohol dependent subjects, and along with NSAIDs, spasmolytic, anti-ulcer, and many other drugs. All are true about all all are true about diazepam except it is insoluble in water. Solution for injections contains several organic solvents like propylene, ethanol, sodium benzoate, and benzoic acid. It is a potent tranquilizer, muscle relaxant, and anticonvulsant. When combined with other drugs as pre-medicant, the incidence of anesthesia is unchanged. The answer is when combined with other drugs such as pre-medicants, the incidence of amnesia is actually increased. So with it enhances these drugs enhance uh, the effects of the other induction agents, and hence the incidence of amnesia is increased. It is insoluble in water because it is highly lipid soluble. Solution for injections contain several organic solvents because it is lipid soluble, and this can cause pain on injection. Also because of this, it can precipitate when combined with other drugs. And it is a potent tranquilizer, muscle relaxant, and anticonvulsant. So all are true about diazepam except it reduces fasciculations. It reduces fasciculations after scoline. In radiodiagnostic procedures for pediatric patients, a drug of choice to reduce hallucinations and emergence delirium after ketamine reduces dose requirement of muscle relaxant. Your answer is uh, it is not. It can be used to reduce hallucinations and emergence delirium after ketamine, but it is not the drug of choice. The drug of choice is midazolam to reduce this emergence delirium. So it reduces dose requirements of muscle relaxant, so it potentiates the effects at the neuromuscular junction. So dose requirements will decrease. It can be used as a sedative for pediatric patients in radiodiagnostic procedures, etc. And it does reduce fasciculations after scoring too, because it does reduce fasciculations. And ketamine is known to cause emergence delirium, so it causes bad trips and all that after the procedure. I mean, after the anesthesia is given. So to reduce that, um, ketam benzodiazepine is generally used. And a short-acting benzodiazepine is preferred because you do not want the action continuing the action of ketamine. So short-acting benzodiazepine like metazolam is used. About diazepam, all are false except consumption of alcohol is safe by patients under treatment. It can be diluted uh, when mixed with most other agents, not painful when injected intramuscularly. It is not the treatment of choice in insomnia. So, it is not the treatment of choice. This is a correct statement. It is not the treatment of choice for insomnia. For insomnia, shorter acting benzodiazepines are preferred because these longer acting benzodiazepines, like I said, the main mechanism is they interfere with REM sleep, these benzodiazepines. So when you use this longer acting benzodiazepines like diazepam, so the longer acting will lead to hangovers because of the continuous interaction with this REM sleeper. But the shorter acting benzodiazepines, they induce sleep, they do interfere with the REM pattern for a short period of time. Beyond that, once the action wears off, the patient does not get up, continues to sleep, and wakes up in the morning fresh. Consumption of alcohol is not safe by patients it as it is additive. The action of the benzodiazepine and alcohol can cause respiratory depression and cognitive impairment, so it is dangerous. Then it can be diluted. It cannot, when mixed with other agents, it precipitates when mixed with other agents, and it is painful when injected intramuscularly. All are true about midazolam except at body pH it is highly lipophilic and is rapidly redistributed after intravenous injection. and mechanism of action interferes with reuptake of inhibitory neurotransmitter GABA, thereby causing accumulation of GABA. Elimination half-life is 5 to 7 to 8 hours, and it is entirely metabolized by the liver, and less than 1% is excreted unchanged by the urine. So it is a short-acting drug. So elimination half-life cannot be 7 to 8 hours. It is 2 to 3 hours elimination half-life. At body pH, it is lipophilic. pH of 6, it is water soluble. So at a body pH, it is lipophilic, rapidly redistributed after intravenous injections because it is water soluble and can cross the blood-brain barriers. It interferes with the reuptake of inhibitory neurotransmitter GABA and hence it leads to accumulation of GABA producing the effects, and it is entirely metabolized by liver, less than 1% excreted unchanged in urine. All the following are true about midazolam except it is less depressant to the CVS. It causes a slight fall in cardiac output and arterial blood pressure with the little change in SVR, blocks EEG arousal from stimulation of brain stem and reticular system. Effect when given IV varies from mild sedation to full general anesthesia. Drug is highly protein bound and slight variation in plasma concentration can cause an influence on the active free drug levels in the plasma. The answer is 1. So it is less depressant to the CVS. It causes a slight fall in systemic vascular resistance. Okay. So an arterial blood pressure. So it causes a decrease in systemic vascular resistance leading to a decrease in blood pressure. There is no effect on the cardiac output. It causes a slight decrease in arterial blood pressure due to decrease in systemic vascular resistance. It blocks EEG arousal from stimulation to the brainstem and reticular system. So it blocks the EEG arousal. It basically causes sedation. So when given IV, effects vary from mild sedation to full general anesthesia depending on what dosage is given. Highly protein bound and slight variation can lead to active free drug levels in the plasma, altering the effects. All are true about midazolam except it used in extremes of age, potentiates effects of narcotic analgesics, hypotensive effects of beta blockers, diuretics, magnesium sulfate nitrates, pain during injection, phlebitis, drowsiness, bronchospasm, impaired motor coordination, diminished reflexes, etc. So it, it is not used in extremes of age, neonate, old age, basically because in old age there is decrease in the cardiac output, which leads to decrease hepatic and renal metabolisms. Because there is decreased blood flow, so there will be decreased metabolism after renal too because of old age. And anyways, with age-related changes in the hepatic and renal metabolism, uh, in neonates, the renal and hepatic systems are not developed, hence metabolism will be very slow and there can be prolonged duration of action. So it potentiates the effects of narcotic analgesics, hypotensive effects of beta blockers, diuretics, calcium channel blockers. It can cause pain during injection and phlebitis, and can cause drowsiness, bronchospasm, impaired coordination, diminished reflexes, etc. All are true about lorazepam except it is similar to diazepam, produces anterograde anesthesia, analgesic properties, enhanced ventilatory response to carbon dioxide challenge, suggesting stimulating effect on the CNS. So the answer is analgesic properties. Lorazepam has no analgesic properties, right? So it is similar to diazepam, produces anterograde anesthesia, enhanced ventilatory response to carbon dioxide, suggesting stimulant effect. All are true about lorazepam except it is the short duration of action, 5 times as potent as diazepam. Oral dose for anxiety is 1 to 3 mg BD. Doses up to 5 mg orally or IV are used for pre-anesthetic medication. The answer is short duration of action. It actually has a long duration of action. Diazepam is long acting drug. So it is 5 times as potent as lorazepam. Oral doses for anxiety 1 to 3 and doses for 5 mg for IV use. All are true about haloperidol except valuable in patients with delirium. Uh, it is a serotonin receptor antagonist. Uh, blocks cholinergic, beta 1 adrenergic, and histaminic receptors. And the adverse actions, extrapyramidal syndrome, neural malignant syndrome, seizures, tachycardia, uh, and agranulocytosis. Okay, the answer is this is false. A mechanism of action is it is a dopamine receptor antagonist. Okay, it is a dopamine receptor antagonist, not a serotonin. It is used in patients with delirium, blocks cholinergic, beta-1 adrenergic and histaminic receptors, and adverse reactions are extrapyramidal syndromes, agranulocytosis, neuroleptic syndrome, seizures, tachycardia. All are true about zopiclone except cyclopyrrolone hypnotic, agonist at GABA receptor and potentiates GABA by binding uh, to other than sites other than to sites other than that of the benzodiazepine, does alter REM, doesn't develop hangover, withdrawal phenomenon, or alteration of sleep architecture, metallic or bitter taste. Oh, I'm sorry. So your answer is it does alter REM sleep. So it alters REM sleep. Sorry, I mean it doesn't alter REM sleep. So it does not alter REM sleep. Because of that, there is no hangover, withdrawal phenomenon, or alteration in the sleep architecture. Metallic or bitter taste is a side effect, and it acts as an agonist of the GABA receptor. Therapeutic uses of chlorpromazine are all except treatment of depression, schizophrenia, antiemetic, anti-hiccup, treatment of preeclampsia, toxicity. The answer is depression. It is used for treatment of psychosis. So chlorpromazine decreases all except of posterior pituitary, body temperature, vasomotor tone, dosage of CNS depressants, hypnotics, analgesics, alcohol, and IV anesthetic agents. So the answer is it decreases the secretions from anterior pituitary. So it decreases anterior pituitary secretions, body temperature, vasotone, and dosage of CNS depressants. Chlorpromazine causes all except dilatation of peripheral blood vessels, increase in coronary blood flow, decrease contractile force of the heart, and decrease irritability, and increase in respiratory rate. So the answer is it increases the contractile force of the heart and decreases irritability, increases coronary blood flow, increases respiratory rate, and causes dilatation of peripheral blood vessels. All are true about chlorpromazine except stimulates the central temperature regulating center, increases effects of both the depolarizing and non-depolarizing, local analgesic, and produces sedation. So it depresses the central temperature regulating center, causing hypothermia. It doesn't stimulate. It increases the effects of potentiates the effects of depolarizing and non-depolarizing muscle relaxants, acts as a local anesthetic, and produces sedation. Chlorpromazine, all are true except it is well absorbed on oral and parenteral doses, distributed in all body tissues with high concentration in liver, lungs, and adrenals. Metabolized in kidney. Metabolites are absorbed in urine for 6 to 12 hours. So guys, your answer is it is metabolized in the liver, not in the kidney, and metabolites are excreted in the urine for 6 to 12 hours. It is distributed in all body tissues with highest concentrations in liver, lung, and adrenal, and well absorbed on oral and parenteral doses. So guys, that was the quiz on benzodiazepines. I shall update my class for tomorrow soon. Till then, please do use my code SASHA and subscribe. And by using my code, you'll also avail the 10% discount. So guys, subscribe, hurry, use my code, get your 10% discount. Thank you. Have a good day.